Okay, welcome to this week. Oliver, excuse me. Sorry about that. Okay, Oliver is very excited that we're going to talk about the musculoskeletal system this week. And in your book, I think it actually divides this into the muscle system and the skeletal system, and we're going to talk about it in that manner. But the fact is that the skeletal system cannot function without the muscles. And you've seen it. Halloween is coming up, and you've seen those skeletons, right? They just kind of hang there, but can't do anything, can't function without the muscle system. And of course, ultimately, the nervous system, because the nerves tell the muscles what to do. But yeah, here we go. It's all connected, just like that song, you know? You know that song? The foot bone's connected to the ankle bone. All right, I won't do that to you. Okay, so here we go. Did you know that babies are born with 300 bones? But by the time they become adults, they only have 206 bones. So where do those 94 bones go? Isn't that interesting? You know, the next time you're at a party with your friends, you share that. They're going to be like, whoa, you're smart. Okay, I'm going to tell you as we go through the skeletal system. Okay, so first, what you need to understand is there are two types of bones. The cortical bones, which are the structure bones. These are the bones that give the body their form. Okay, otherwise we would just be, you know, like a Halloween costume without anybody in it. And the cancellous or the trabecular bones, which are the soft, spongy bones, the ends of the long bones. And they are also found in the pelvic bones, the ribs, the skull, and the vertebrae and the spinal column. And you will note that these are juncture bones. They are found at the juncture, whether between bones or other organ systems. So that's why they have to be soft and spongy, as opposed to the hard and fast bones that you have in your cortical bones. Okay? Now remember, no matter what you're going to be when you grow up, you need to understand these terms because this is the language of healthcare, no matter what. And I was just talking to somebody who was sharing with me their experience at the physician's office, and that particular physician was not very good at speaking in regular people talk, lay terms. And so this patient was just like, what? I have no idea. What are you saying? And this particular physician, which is wrong, very wrong, kind of got annoyed and said, well, I just told you. Well, now let's try not doing it in Chinese. Okay, thank you. Let's do it so we can understand. So this is a way for us as patients and the loved one of patients to kind of meet physicians halfway and get some kind of idea or concept of what they are talking about. And all of your education in healthcare is going to support that, by the way. So you're here, and every part of this education is twofold for your professional purposes and your personal purposes. Okay, so the adult bones that we were talking about is, first of all, we have the sacrum and the coccyx. And when the baby is born, these are actually separate individual bones. But by the time a human it gets to about 20-25 years old, these fuse into one bone. So there goes some of those bones that you were wondering about disappearing. Okay. And certainly you have this picture in your textbook, but it's good to help you remember if you are going to work for an orthopedist or in an emergency room or clinic, emergency clinic. This is very important knowledge for you to have where all the pieces parts are. All right, so let's talk about your skull. The smallest bones in the human body are in the ear. Actually, to be specific, the middle ear. The anvil, the hammer, and the stirrup are located in the middle ear, and they process sound as it comes from outside through the external ear into the middle ear, and then on into the inner ear and the labyrinth, where it then follows the nervous system into the brain. So the brain can say, oh, my baby is crying, or, oh, the dinner bell. Wonderful. Okay. The skull, which is the bone that surrounds the brain to protect it, is also, I want to say divided into sections like you see here in the different colors. I promise you, under your skin of your skull is not in really these colors. That would be really pretty, wouldn't it? Yeah, I think so. It would also help some surgeons to know, oh, I'm in the blue area. I didn't mean to be parietal. I meant to be frontal. Okay. Then you have, so your frontal is, imagine this, hard to learn. So you might want to take a note. Your frontal section of your skull is in the front. Okay. Then you have your parietal, which is the top of your skull. That's the part, you know, when babies are born, that's the soft spot. That's the parietal bone, has not closed up yet again. And temporal is the side right above and around the ear. You have your sphenoid right in front of your temporal bone, and the occipital bone. And for those of you who like to watch crime dramas like Law and Order or any of those other shows, a lot of times you will see, well, the patient has a blunt force indentation in the occipital portion of the skull, and then, you know, they were hit in the back of the head. Okay. And ethmoid is inside behind the juncture of the nose. Okay. Are you excited? This is all working to help protect your brain, although not sufficiently that if you don't wear a helmet when you're riding a bicycle or a motorcycle, you still can get TBI, traumatic brain injury. Don't want that because it's a skull, it's bone, it's not impenetrable. All right, let's go on to your upper extremities. Okay. These have these bones are your axial skeleton as they connect to your torso. And you see the clavicle is that bone right here that you can feel. Yeah, exactly, right there. Okay. And then you have the little notch, which is right at the top of the sternum. Okay. Your scapula are those bones that kind of look like a butterfly in the back. Okay. They kind of stick out. Find somebody who's really, really skinny, then it's easy to see. I'm not one of those people. Okay. Then you have your humerus, which is between, connects from your shoulder to your elbow. Okay. One bone. And I didn't name it humerus. I don't know why they named it humerus, But if you remember, if you've ever heard somebody call their elbow the funny bone, that's where it comes from. Although I don't find banging my elbow very humorous. Get it? All right, never mind. All right, then between the elbow and the wrist, you have two bones, the radius and the ulna. Now, one thing, and when we get to the lower extremities, you will notice is the structure of the bones in the arm are very similar to the structure of the bones in the leg. And by that, I mean one long bone from the connection to the torso and then to the joint. So in your upper extremities, it's your elbow, and in your lower extremities, it's your knee. Okay. And then you have two bones in the lower portion, in this case, in the upper extremities between the elbow and your wrist, and in your lower extremities between your knee and your ankle. So you see how that is similar. It can help you remember one bone, two bones. Okay, now this is very interesting, and I almost don't believe it, but evidently it's true, because I would not tell you something that's not true. The bones in your hands, both hands, from your wrist, and your feet from your ankle to your toes, you add those bones up, 106 bones. So your hands and feet are the equivalent of half of your skeletal properties or components. Isn't that amazing? And that's because, and you'll see when we get to the hands, all of the bones that are actually creating these very interesting inventions, okay, especially with our opposing thumbs. Very, very important. And I want you to think about that a little bit as you go through your daily life. I mean, think about what would happen if you broke your thumb, or heaven forbid, if your hand was amputated. And the reason I say that is not to be gross, but I want you to be cognizant, because you are going to work or are working in healthcare. We deal with people that have all kinds of disabilities. And when you can kind of understand what they may be going through, it helps you be not only a better healthcare professional, it helps you be a better human being. Okay? We don't want to make fun of people with a non-functioning arm or or an amputated limb. We want to understand and think about how hard that must be to do your activities of daily living, do work on the computer, all of these things that you do without a second thought. So this will help you be a better human being. Okay. All right, the pelvis. Gimme, shimmy, shimmy. All right, so you know that, and in this area, we have a term. You'll notice on the left side of your screen, inside the bracket, you see ilium, okay? And we talked about this way back in week 1, I think, is ilium, ILIUM, is this portion of the bone that constructs to your pelvis. Okay? But ilium with an E, ILE, is actually an organ, the very end of the small intestine. So this is a good reminder that you not only have to pay close attention to the way a term is spelled in writing, You have to be cognizant, thinking, thoughtful of what it means if somebody is saying this to you. Are we talking about a bone in the pelvis? Or are we talking about the end of the small intestine? Okay. I'm sorry, but if you're going to work in healthcare, you have to pay attention to the little things. You have to be a little OCD, obsessive compulsive disorder, or as we call it, CDO, because people with OCD would want the letters to be in alphabetical order. Nobody's laughing at that. Okay, never mind. You will, when you get into one of your clinicals, or, a future class where they're talking about this, mental illness, you will, oh, that's what Dr. Safian meant. Okay. So there's a difference between the male pelvis and the female pelvis, not really in construction, but in shape. And you can see that this is a female pelvis because it's heart-shaped. Isn't that nice? Oh, okay. As opposed to the male pelvis, which is boxier. Okay. You can also see very clearly in the center of your screen, the sacrum. You see the sacrum and it's pointing, and you see those bands? The sacrum on this baby, when this baby was born, the sacrum was 5 different bones. But this adult, it has now fused into one bone. And you can see the coccyx, your tailbone. If you've ever fallen off your bicycle or down the stairs accidentally, you know where your coccyx is. Okay, so the coccyx, you see those, again, those lines when the baby is born, those are all individual bones, which then in adulthood, over the age of 20, usually about 23, 25, fuse into one bone. Okay? Does that make sense? Good. And this is also why, if you remember, I've told you over the past several weeks that it's good to have a medical dictionary. I actually have one medical dictionary. It's called the Illustrated Medical Dictionary. Why? Because it has pictures. It helps me better understand when I'm looking to see what is that body part, what is that anatomical site, when I can see exactly where it is or how it's formed. Okay, that's certainly up to you, but it might be something you should consider. Okay. All right. The lower extremities, as you remember, I told you before, you'll see the basic structure is the same. The leg is the same as the arm, where you have that one solid long bone. In the arm, it's the humerus that connects the shoulder to the elbow. In the leg, it's the femur that connects the hip bone or the hip joint to the patella, which is your kneecap. Okay, and for your pleasure, the next time you're at a party, the femur is the largest bone in the human body, and it takes an incredible amount of force to break this bone because it's so big and strong. So that gives you an idea of somebody actually, if you have a patient who actually fractured their femur, that took a lot of force. Okay. All right, the patella, your kneecap, and then that is followed between your kneecap and your ankle, the tibia and fibula in the leg, as opposed to the ulna and the radius in the arm. This is very exciting. All right, now, additionally, in this terminology class, I want you to begin to understand the terms that are used to describe the types of fractures, because bone fractures are not unusual. They happen all the time. And it is very important, regardless of your future professional role. Okay, if you're a nurse or a medical assisting, you need to understand, because you'll probably be involved in the treatment of the x-raying and the cast. Okay, if you're going to become a coder in the medical records, you need to know this, because each one of these different types of fractures is reported with a different code. It's not enough to know that the patient has a fracture. You must know which specific of the 206 bones have been fractured and the type of fracture. Isn't it amazing how many different ways we can crack our body open? All right. So, any questions with regard to the skeletal system? No. Okay, then let's move on to the muscles. There are more than 640 named muscles in the body, and many, 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 many more than that that don't have names. Okay, isn't that sad? All right, but that's okay. They're what we call the lesser known. They're the lesser known muscles. You don't have to worry about them. You don't have to memorize them. But what I do want you to remember is, depending upon where you go to work, you may need to become familiar with a particular sector of muscles. Okay, but let's now look at the different facts about muscles. The longest muscle in the human body is the sartorius muscle, which is the thigh muscle that helps the femur function. So that makes sense, right? This is the biggest bone, and it has the longest muscle. And it is the longest portion of the average not normal, I don't like that word, human body. Okay, the teeny tiniest, the smallest muscle, look at that. It's in the middle ear with the tiniest bones. Stapedius muscle, which is right near the stapes, which is one of the tiny muscles. Do you know that somebody could fall off the Empire State Building, land, break every single bone in their body except the 3 muscles in the middle ear? That's how well that's protected. Okay, the largest muscle. Now remember, notice this. Not the longest muscle, the largest muscle is the gluteus maximus, the outermost muscle of the buttocks, the booty, the bump. Okay? Strongest muscle, right here in your jaw, used for chewing, the masseters, which is why the medical term for chewing is mastication. See how that ties together? And the busiest muscle, oh my gosh, the eye muscles are so busy. They move something like 30,000 times a day. Wow. All right. Look at all that stuff we have to look at, and then we have to send all that information up to our brain. Okay, and sometimes you look at something and it never gets up to your brain, and that you don't remember what you saw. All right, so the muscle groups, and again, this is particularly important for those of you who are planning to go toward a clinical position, is the groups of muscles are identified by their size: huge, large, long, small, short. Vastus, maximus, longus, minimus, brevis. Combination of Latin and Greek. Okay, or the shape of the muscle. And you may think of a muscle as being, long and thin, but they're not. We have a deltoid muscle, which is triangular, a rhomboid muscle, which is equal and parallel sides, but not a square. So like that. Oh, like that. Okay. Latissimus is wider than it is long. The teres muscle is round. The trapezius is like a trapezoid. Oh, that's why they made you take math. Okay, you see, you do need that. A four-sided figure with two sides parallel, but not all the sides parallel. Okay, sometimes the muscles are grouped by the direction of the fibers that make up the muscle, and sometimes the groups are or the muscles are grouped by their location. The pectoralis muscle, the chest muscle. Men particularly like to work the pectoralis, the pecs, right? You've heard that. The glutes or the gluteus muscles, you're behind. Okay. The brachii arm, and this is where your brachial nerve is. Remember that? Okay. Supra, remember you learned that in week 1. Supra is above, infra, below, also sub, under or beneath, and laterus, which is lateral. Okay. So you see the repetition, you see how some of the same words, sometimes they use familiar words like the math words. Okay. So now you can make better connections in your head with things you already know, which will help you remember this. Okay. All right. Muscle groups are also established by the number of origins. Now, as you have learned, or maybe not yet, but now you're about to, is each muscle has an origin and an insertion point. So sometimes one muscle might have 2 origins, 3 origins, or 4 origins. Then you have those muscles that are named specifically for their origin insertion. So you have the sternocleidomastoides. So sterno, right? Come on, you can figure this out. Sterno is your sternum, cleido, clavicle, and mastoid, your jaw. So you see how that muscle is connected. Brachioradialis, say, you know, health information management. I write, I read, I don't say, but you're going to help me out, right? Brachioradialis. There you go. See, you can break it up into parts. So the brachium, or the arm, with insertion in the radius, the lower part of the arm. And you will find that muscles are named for their actions. So an abductor, A, B as in boy, D as in dog, is to bring in. Adductor, A, dog, to bring away. Did I get that backwards? Anybody? Did I get it right? Huh? No? Okay. If you find out, email me. All right. Okay. So orthopedics is a specialty. It's a medical specialty that deals with the treatment of the musculoskeletal system, particularly the spine, the joints, and the muscles, where most people have the most concerns. Okay. So this is the specialty that involves the musculoskeletal system. And there's no specialty that only deals with muscles and only deals with skeletal issues, because they are inextricably connected. So you might find this interesting and maybe think about it as a career path. And even if you want to go work in a hospital, they certainly have the orthopedics department. So it's something to think about. Okay. And look at all those muscles and know the adult muscles in the front are different from the muscles in the back. And it's okay, because You don't have to name all 650, 60, 70, 80 muscles, especially the ones that don't have names. But again, as I've told you, keep that anatomy book handy. Keep that medical dictionary handy. So as soon as you see, oh, it's a biceps brachii, now I know that's a muscle that has to do with strong. Yes, right there. Okay. And one more categorization of muscles, the skeletal muscles involve movement, okay? They're the ones that let you do this or this, okay? Smooth muscles are involuntary muscles. Those are very good to have because your nervous system will tell your heart muscle, which is a smooth, well, it's a cardiac muscle, but it's a smooth muscle, and it tells your blood to pump, so that you don't have to sit here. It also helps with your breathing. So you don't have to sit here and go in, out, in. Could you imagine if you had to tell your heart muscles, your lung muscles to do that? You would not be able to do anything else because I'm pretty sure that would take up all of your time. Okay, so again, these are things might be on a test, but more importantly, they might be involved in what you are going to do in your future. And again, if you have kids, especially, but adults, you know, somehow damage themselves, you know, it makes you a better patient or a patient's advocate when you can actually have an intelligent conversation with the physician. Okay. So what am I going to tell you? Review often. That this is not memorization. This is repetition, repetition, repetition. Use that medical dictionary. Email me and query me whenever you're not sure about anything. And other than that, have a wonderful day. Have a wonderful week. And I will see you next week. And I will be in the course and in my email 7 days a week. You know I am. Bye.